but I'm going to come to you in a moment because I've just been told India has reported 392,000 cases, COVID cases in the last 24 hours, 3,689 fatalities. So both are new highs, but marginal dip in daily COVID infection. Sorry, marginal dip in daily COVID infection. It was, I think, 3,95,000, which has come down.
4,01,000 yesterday.
4,01,000, which has come down to 3,92,000.
What you need to look at is a 7-day rolling average when it comes to COVID. You don't need to look at a single day thing. Plus, there is Saturday, testing goes down, results go down, labs
is your DIU data that you all gives with such clarity showing that in states like Maharashtra, which were the first affected, there is a slight decline? Am I correct?
There you need to look at the reproduction rate, the R rate, which is coming down in Maharashtra, but is going up in Uttar Pradesh, going up in Jharkhand, going up in Chhattisgarh.
So new states are emerging.
So if Uttar Pradesh were to calculate properly, in a few weeks from now, UP itself will report 1 lakh plus cases. That's what the data says. Now,
that's if they report all the cases and if they test more aggressively.
And if they account honestly, if they decide that if you don't count, you never know. That's a different matter. But if they the R rate is almost 2 in Uttar Pradesh, which essentially means if you've got about 30,000 cases, those 30,000 are infected 60, and as that marker goes on, there will be 1 lakh plus cases. It is only inevitable, the data suggests that. But then, of course, we have a way in India of suppressing data.
No, yesterday in Goa, for example, positivity rate was 51%.
That means they're under-testing.
They're under-testing, but clearly that also shows that there is a serious problem in terms of the infections in certain states, which were relatively immune to it in the first round of the second wave in late March, early April.
A test positivity ratio of more than 10 essentially suggests that your state is under-testing. You need to test much more. Just by testing lesser, it doesn't send the virus away. At least if you test, you can trace, you can contain, you can isolate. If you don't trace, you've got people, as there is in certain parts of rural Uttar Pradesh and Bihar, just dying without medical infrastructure because they never got tested, they never got treated, and they had no one to take care of them. So that is deeply unfortunate. But hopefully we can scale up our capacities to test, and we need to bring in more oxygen. I think that, Rajdeep, really is key. Having more oxygen, so people don't die because they're not getting air to breathe. That's like in Batra Hospital in the capital, 8 people, including a doctor, died because they didn't have oxygen. Hospital administration is calling us in panic, saying there's only 1 hour of oxygen, half an hour of oxygen. You can
and
have
the
a
worry
heart
is
attack
that's
with the
in the
anxiety.
national capital. Imagine what happens in, say, Saharanpur, in Meerut, in Kanpur, in Uttar Pradesh, large population, densely populated, hospital infrastructure not as quite as good as the national capital. That is where the real fear is. Rural Bihar, which relatively escaped the first COVID wave last year, that's where it's now spreading at the moment. Chhattisgarh, Madhya Pradesh, again, there have been cases of oxygen deaths in smaller hospitals. I think that is the bigger concern at the moment, clearly. So as we look at these numbers, we are also going to be looking very closely at the COVID numbers, not just today, but every single day, and mapping them very closely, because that remains the biggest story of our times. 3,689 COVID fatalities yesterday. And remember, those are the ones officially reported through the hospital system. There could be many more who are dying at home as well. So the virus is very much there, and that's the challenge that any political party will face at the moment. Nilanjan, West Bengal was interesting because the news